In closing, let's just talk a bit about where we're going to be going next, or what kind of research directions have come out of this grant. So we've talked quite a bit about sustainability, and this is sort of what we've really been hearing from our sort of like key knowledge users as a really important thing we have to focus on now, thinking about sustainability. And so this is some work that, Mui's kind of doing at the moment to really sort of think more about this focus on sustainability and to answer some really direct questions for decision makers about how, or what are the models that GetCheckedOnline can be sustained and expanded over the long term, and how could it be? We talked earlier about this sort of being, a bit siloed funding. How can GetCheckedOnline be better integrated within the health system? And so that's some work that's currently underway. Just in relation to the business, that sort of notion of continuing to generate evidence for of the value and the benefits of GetCheckedOnline, we have other work that's currently underway. Mike Irvine, who's on the call today, is sort of leading a mathematical modeling study to look at the impact of GetCheckedOnline on averting syphilis infections amongst US LGBTQ men. And it's sort of building on previous modeling work that Mike has done about GetCheckedOnline and HIV. We also are planning, sort of in the early phases now, but planning some future research in terms of like better looking at the program data and overall testing data to understand the impact of GetCheckedOnline on overall testing in communities and what that looks like and how that's changed over time. To take that information and then project what the impact might be, particularly in rural and remote communities. And then finally to build on work that Wei, who's on the call, and others have led, doing costing around GetCheckedOnline to look at the distributional cost effectiveness, which sort of brings an equity lens in thinking about that. And that's been a method that we've been advised has been helpful when trying to make a case to the Ministry of Health. So we're looking forward to doing that work coming out. I've mentioned a couple times about self-collection kits, and that's definitely a new direction that has come out of this work. Actually, when going through the slides, I realized that, back in 2021 in our team grant meeting, we actually had a focused discussion about this in terms of that was in the very early stages of us thinking about this. And part of this came because of the need to recognize that the Life Labs based model only goes so far, and thinking about other reasons. But I think we've also found from our research that, that there's been high willingness to use self-collection kits. I think we spoke a bit earlier to some of the, the implications of self-collection kits in relation to these potential missed opportunities to provide testing. And so we have a couple of projects underway currently. The first is looking at how should self-collection kits be designed and best implemented in Indigenous communities. And we have the privilege to support this research project, which is being led by the Chiwamuk Indigenous Health Team in partnership with 5 communities that they have existing relationships with. And then we recently got, finally got, I should say, project grant looking at self-collection kits and how similar kinds of questions, but focusing on rural and remote communities specifically, and really seeing this as a complement. These are complementary research grants. One of the findings that came out of our community survey that Ro had been talking about was looking at, or this is actually, I think, the client survey, yeah. This was looking, you don't really need to read the fine print here other than see the obvious pattern, which is that by different measures or components of digital health literacy, people who use GetCheckedOnline, shown in blue, have a much higher levels of digital literacy or health literacy compared to what sort of is sort of a BC average of what we see in another data source. And that's not surprising. We've always thought about how the folks who may have those greater digital literacy skills maybe more find GetCheckedOnline more easy to use, and that was affirmed a bit by what Mui had shared earlier. But we're now also beginning to focus, shift to talk a bit more explicitly and focus on digital determinants of health, and looking at those from at an individual level all the way through to a society and structural level, and really asking the questions: how do digital determinants of health affect access to STBBI related services generally, and focusing on the experience, particularly of people from maybe more socioeconomically deprived groups where there's a disproportionate burden of STBBI, as well as the perspective of service providers. Sarah, who's on the call, is sort of part of this work going forward as well. And was it sort of where some of this importance of this really also originated, was sort of hearing about that community-based organization perspective about the supports that they need to provide to their clients in order to access digital health services. So in closing, this was also, I know Aurelia, I have you to thank for this quote and highlighting this quote, which we highlighted at the very beginning of our team, first team meeting, but also just really recognizing the implementation science is very much a team sport. And this has been quite an impressive team to be part of over the course of this grant. And why, cannot thank everyone specifically, and I've done my best to sort of capture folks here, but do just really want to be really grateful to everyone for their support of this program. And I recognize as well that many of the folks who are, on this call or that we've been speaking to who are not sort of part of our research team, but have really, really volunteered their time to participate in studies, to talk about this grant, as well as thanking all of the folks who did complete our surveys and participate in the interviews that we did as well. All of our research findings are on our website, the Digital and Sexual Health Initiative, and just acknowledging as well CIHR, which was the funder of this research. And just want to close with a note that we're really open to hearing from you in terms of any reflections that you have on this team grant. What worked well, what are things we could look at improving better for next time, and just encourage you if you have any reflections you'd like to share. It'd be really helpful for me in sort of thinking about how to do this kind of work again, and feel free to just email me directly, and happy to have a chat. And with that, I think that brings us to an end of our webinar with 1 minute to spare. So thank you again, everyone. And thanks for taking the time to be with us this morning. And I look forward to continuing to share findings that have come out of this team grant and engaging with you on some of these new research directions for our team. So thank you very much.